Hi, my name is Elizabeth Bondi-Kelly. I'm a postdoctoral fellow through the METEOR program at MIT. I'll be joining as an assistant professor at the University of Michigan next year, and I just finished my PhD at Harvard University in computer science. My research interests largely focus on artificial intelligence for social impact. I'm trying to develop algorithms in multi-agent systems and machine learning to support domains like conservation and healthcare. Since I've been here so far, I've been looking at these healthcare domains, particularly trying to work with clinicians and patients to support their decision-making processes. We're looking at some specific questions like what happens when we present AI advice to folks from different backgrounds. So for example, maybe you have some expert radiologists versus some emergency room physicians, or maybe you have patients who have varying levels of expertise as well. Basically, we expect that people with different levels of expertise might use the AI support systems differently. So someone who's an expert in their field may potentially not want to use an AI system. They may distrust the results that come from the system, or they might say that they do. But on the other hand, someone who maybe is less experienced in a particular domain, maybe you're a patient or maybe you're a medical student, you might really want to listen to AI advice simply because maybe you're a little bit uncertain. There are a lot of different questions that have come up when we're translating from what we've developed in the lab to what we're trying to deploy with real users in the field. So one project that I worked on was trying to automatically identify animals and humans within conservation drone imagery and provide predictions based on that live imagery to our park ranger collaborators. The goal was to do that in real time so that if they saw something, then they could alert other park rangers to go and potentially investigate further and try to prevent poaching in real time. But the challenge behind building that system first was, of course, going through all the data collection questions and building the AI system. But then when we went to try to deploy it, a lot of different questions came up. For example, people wanted to simply have like a ding associated with the detection rather than just having a box show up on the screen just to make sure it caught their attention. And other things came up as well. For example, they didn't want to have alerts happening all the time. So when we're thinking about developing an AI model, they don't perform perfectly most of the time. So we have to prioritize where we want mistakes to happen potentially. So whereas we were prioritizing trying to make sure that we showed every possible prediction, because they had limited resources, it was better in that case to just show the ones we were more sure about. So lots of different questions come up through those collaborations and those iterations. So in general, I find that when you're working on these projects in AI for social impact, a lot of times new computer science challenges arise, and a lot of times we need to develop new algorithms to support those use cases. So I like to think of my research as use-inspired. I want to develop new algorithms, but I really care about developing new algorithms that will support these real-world applications. And then in terms of the time that I have left, we're hoping to do some experiments with doctors, clinicians, patients, and potentially even deploy one of these systems. But in general, I've really enjoyed my time here at MIT, learning from all of the great people and developing some of these new research collaborations and directions.